Welcome to the S40M S40E Speaker Spotlight Series. These short conversations are designed to introduce you to the brilliant clinicians, educators, and researchers joining us at the summit, not just for what they teach, but for who they are. Today, I'm joined by Cara Thurman, and I'm so excited for you to hear their voice and perspective before the event. Welcome, Cara. Thank you for being with us today.
Thanks for having me, Erica.
So, let's about your session. I'd love for people to hear a little bit about you. When people see your credentials, they see the professional. What personal experience shaped your path the most?
I would say I was born with a congenital heart defect in 1977, a pretty severe congenital heart defect. And so at the time, there was not a lot of interventions. And in fact, they told my parents if I lived until I was 5 years old, that they would try to do some surgery. So I've had open heart surgery 5 times. I have a pacemaker that works 99.9% of the time to keep my heart rate above 30. And I'm kind of constantly figuring out how to live in a way where I feel good enough to do the work I want to do. And so when I had my fourth open heart surgery in 2009, I decided this is what I wanted to do. I wanted to be able to provide massage therapy for medically frail patients, whether that's oncology patients, which is what it ended up being for me for the most part, or, anywhere within the hospital system. I truly believe that this is a service and a part of care that is so important, especially for chronically ill people or people who have long-term illnesses, because those kind of illnesses not only they it's not just the physical effects for people, it's the long-term psychological effects of living with pain and fatigue and the constant worry of, I think in cancer a lot of times we call it scanxiety, just what's going to be next. How long am I going to feel good enough to do what I want to do, or how long am I going to be this sick? And so I truly believe that body work integrated into Western medicine can be something that really changes quality of life for patients, and it's extremely important to me.
That's so important. And I think you'll find in the community of S4OM, as you know, that we all kind of really believe and understand how important this work is. Thank you for sharing that part of your story.
Of course.
What keeps you passionate about the work?
I think a lot of things keep me passionate about the work. First of all, I am the founder of Vinings Massage and Wellness, which is in Northwest Atlanta. I've been, working with that for since 2012. And along the way, we've had so many amazing team members. And right now, we have so many amazing team members, especially on our oncology massage team. I'm now NCV TMB certified to teach oncology massage therapy. And so the wonderful thing is, our office in Atlanta serves almost as an incubator at this point, right? Like where people come in and we can identify, is this something that they may be good at or interested in? And the amount of people who end up being a good fit and really showing the empathy and professionalism and just, above and beyond that kind of work ethic where they will meet that person where they are, and even if it kind of takes something from them, they want to give that. It keeps me going, and it just makes me feel good that we continue to see people who come into this profession who want to have more,
Mhm.
have some more stability, have a job where they know that they're gonna be at the hospital X amount of hours, and they know that they're gonna make X amount a week, no matter how busy it is at the office or not, and they're willing to show up in a way that's professional enough to be in those spaces.
It's also really, I think, nice to see people evolve as professionals.
Yes.
And I'm assuming when they come to you, they are really ready to take that next step, or you feel like they're ready to take that next step, and how wonderful that you can offer them that opportunity.
I'm grateful. I'm very grateful. And I think we talked a little bit before we started recording. We do monthly oncology massage lunches or dinners. And it's hard to describe, but the feeling at those gatherings is just so helpful. And looking back from to when I was doing this work on my own back in
Mhm.
2012, it feels so good to know that we can support each other because it can be an isolating way to work,
Mhm.
and that can be detrimental to long-term to longevity, and so that's one of the things that we're really trying to help our team with also.
That's wonderful. So let's talk a little bit about your summit presentation. When did collaboration become more important than independence in your career?
Well, I'm gonna be honest with you, I am 100% extrovert. I love people. I love connecting with people. It really brings me joy and energy, and it really I think, like I said, thinking back to 2012, 13, 14, when I was pretty much working alone, solo in the hospital, and ended up building a clientele that just happened to be more end of life oncology patients at the time. In 1 year, I had 3 long-term patients pass away, and although I was close with their family at that point because we went through, hospice care and end of life care together, not close in a way where we were sharing, I was invited to the services, but not close in the way where there was really that support. I still definitely was very much an outsider, which is I mean, that makes a lot of sense. It's I was a professional in their life. I was not, a part of the family. But it really opened my eyes to, if we want people to be able to do this work long term, we have to provide teams and or collaboration. So collaboration within teams kind of started then.
Mm.
And then as our work grew, meaning as we wanted to bring this work to more people and be able to provide this work for people that, in all socioeconomic levels of life, we realized we really do need to collaborate with nonprofits, with different organizations that may be able to identify and set aside funding for these programs so that we can continue to make sure that our team is well compensated and has a job that is sustainable long term financially, but also people who need this work aren't paying exuberant amounts of money for it, and in some cases, it's 100% free to them. So,
Mhm.
that was really important for me. So, collaboration on both sides with both teams and with outside entities from our business. We have, a lot of organizations that we work with in a partnership situation, everything from hospital systems to the American Cancer Society to, smaller Atlanta or Georgia-based nonprofits.
Wonderful. So making it accessible, really important
100%.
in that
Yes, thank you.
collaboration. That's amazing, that's amazing. So what does intentional practice actually look like in a real clinic day?
I would say, again, I always go back to support and connection. This work is not easy. We work with a nonprofit here in Atlanta right now that we can provide 3 free 60-minute table massages for patients, caregivers, and or survivors. And so we do at times have people that are in active treatment coming in, and they're really not in a good place health-wise. And again, I think we just have to think about the weight that therapist carries moving on from that appointment, and especially in our office because they could have an oncology patient, and then they could have a prenatal patient, and then they could have a sports massage, and so they're kind of all over the place in that one shift, and so really making sure that we're checking in between sessions, A lot of times if I'm at the office, I go into the room after the client has left and I help change the table over and refill the towel caddy and just check in, even just a small like, how you doing? What do you need? And then just knowing that we have Heather Lenhart is our studio manager right now, and we call her the mama. She's just like amazing. Her door's always open, so even if it doesn't have anything to do with the work at the office that day, because as we all know right now, the level of stress and anxiety in everyday life for people in just our world is really different than anything we've ever experienced before. And we know that that also adds to the overall weight that our team members are carrying. So it's really just a lot about, making sure they know we're here, checking in with them, doing our, quarterly lunches, dinners, and even just something as silly as like on a Saturday, ordering lunch for people and just, having it in the back room and being back there to be like, "Hey, you got this. We'll get through the day, grab a sandwich or whatever." I think it's only been really recently. I remember, even back in the day and probably like, the first 4 or 5 years I ran Vining's Massage and Wellness, I've always verbalized that I really want to elevate the profession, make sure that this is like something that's a, sustainable career path for people. But, it took me a while to kind of grow into my own voice and be able to express that in a more clear way and really be able to start living that. And part of it is just I'm so grateful for the growth of our business, just to be able to employ more, people from different walks of life, people from different backgrounds, things like that, where over the years, it's just really taught me that, like, this is really important. If people love this profession and this is what they want to do, not only am I an advocate for, adding massage therapy to hospital-based programming and care plans and elevating our industry that way, but really working with massage therapists at the ground level to help them understand, like, I get it. Some of you got into this career because you wanted to work for yourself, or you wanted to not have rules, or you wanted to not have a schedule. But if we really want this to be a sustainable long-term career, overall, for most people, we have to have a certain level of professionalism. We have to be reliable. We have to look a certain way. And that doesn't mean you can't have tattoos and piercings and do your thing, but you have to be clean and you have to have a clean uniform and you have to be there 15 minutes before your shift starts. And just these little things that, you know, honestly, in some parts of the industry are still hard to uphold, which, it's such a dichotomy, right? We want this professionalism, we want to elevate our career, but then we do also still have so many people that just I don't know if they want to or they just don't understand the difference. So, that's one of the things with our team, it's very, very clear when they come on, whether they're only in the office or whether they're on all 3 of our hospital teams, which is patient facing, employee facing, corporate, like whatever they are, they know that, like, with us, you don't just not show up. You don't come in 20 minutes late smelling like you didn't take a shower this morning. Like, I get it. People have days and we're flexible. We can be, compassionate, but it has to be a certain level of work. And so it's kind of advocacy on both sides, honestly. And even working with schools at this point to try to help me understand what when people come out and they think they're going to make $200 an hour and work for themselves and only work 4 hours a week, like, where are they getting this? Is this and I'm not saying that's what the schools are teaching, but I'm just trying to, understand what is the curriculum and what is are we setting these people up for success? Are we being honest with what this industry is, which is it's hard work. and it's a lot of work, and it's you got to keep it going. It's you have to be constantly ready to continue to go, although of course we all need rest, but you know what I'm saying. It's kind of working on all fronts to try to understand, like, how do we better set people up coming out of schools to understand what the industry is, what they're looking for, right? Because there's a lot of different options. We can go into a spa specific, we can work with someone more like us that has more hospital-based programming and more treatment-based massage. You can do your own thing. So just really trying to help me understand and help the schools set the our, new therapists up to be successful.
Yeah, that's important. All right, one last question before we close. What gives you hope about the future of oncology care?
I have a lot of hope with the future of oncology care. I'd say massage is being more and more referenced, even at the Society for Integrative Oncology this past year, 25 in October. I was picked to do a pre-conference workshop, and it was specifically on oncology massage, nothing else. And so that gives me hope that this is something that people are really interested in, want to know more about, want to do some integration. And I will say it feels like it's been an uphill battle trying to get every single program that we've started has been the long game. It's always 500 meetings and 20 times meeting and 15 different proposals and where are we going to get the funding, and but it's all worth it because when they actually launch, we are providing this service to people of, any socioeconomic level, and it's free, and they don't have to worry about it because it at some points in cancer care, there's too much stress to really think about paying for a massage. And so we've been able to launch, we're working on 2 programs that we're hopefully gonna be launching in 2026, and I'm I'm grateful because I think there's a lot of people in oncology care that are seeing this as a value, as something they wanna add to their programming. And although it's always hard to find the funding, the space, the way to do the program, we can always do that. We're flexible, we work with each institution or each entity as if, like, we've never worked with anyone before, right? Because we want it to be exactly what this entity wants and what works best for their patients and clients. So, I'm very hopeful because we've been able to identify more ways to start these programs. It seems that people are more interested at this point, right? We've been getting more inquiries or at least more, "Okay, let's talk more about that."
Yeah, I think there's definitely more acknowledgement to the benefit, and therefore that allows people to be interested and also to figure it out,
Yeah.
right? They're just like, "Let's just figure this out." And that's a very hopeful moment and very different than where we were 20 years ago when they were like,
100%.
"Here's a dollar. Can you
Yes,
come into the hospital and do
yes.
some massage for people?" Yeah.
I mean, and I will say, we are very, like I said, we're very flexible. I mean, if we're looking at a program we're having a hard time getting funding, we'll come once a week. We'll come twice a month. Like
Mhm.
just anything to get into the door because once they see the value of what we're bringing and they start getting the feedback and they start understanding the ROI for their
Mhm.
investment, then those programs can grow.
Yeah, they'll figure it out. They'll figure it out.
Yes.
Yeah.
All of a sudden, oh,
Yes. "We found some money. We
yeah,
know what
we
to do
got it.
with that."
We got it. But
Wow.
yeah, I'm very grateful. There are more and more people, especially in the, program development, advocacy, patient support roles that
Mhm.
are really serious about trying to figure this out with us. So that's great.
Amazing.
Yeah.
Amazing. Thank you for sharing that. And thank you so much for being here and for the work that you're bringing to the summit. We really appreciate it.
Thank you for your time. Thank you for having me. I'm really excited to be part of the summit this year. And yeah, I can't wait.
I think it's gonna be awesome. So, to everyone listening, this is just a glimpse of the depth that Cara will bring to their session. We can't wait for you to experience it in full, and we'll see you in a couple months at the summit. Thanks for listening.
Thank you.
If this conversation resonated with you, it's just the beginning. This episode is part of our Healing Summit speaker series leading up to the 2026 Virtual Oncology Massage and Aesthetic Healing Summit, happening on April 26th. Each week, we're sharing conversations with our speakers, offering a deeper look into the work, the perspective, and the heart behind what they'll be teaching. If you're feeling inspired, I invite you to join us live. It's a full day of learning, connection, and collaborative growth in oncology-informed care. You can explore the full summit and save your spot at s4om.org. Until next time, thank you for being a part of this community and for the care you bring into the world.